Hello people, in this video let us look at the pathology practical record. So this is part 1 introduction, part 2 clinical pathology. So routine urine analysis, how to measure blood sugar, protein measurement. So this is all your biochemistry type of thing. Bile pigment, Fauchett's test. Microscopic examination of urine. You remember all this, guys? So basically in pathology you are learning a little of biochemistry also, isn't it? Microscopy. Though we didn't do, looks like they have some theory on semen analysis. Moving to part 3 now, guys, hematology. So Carl Landstein, a blood group system, remember? Bombay blood group, Bhendi. How to calculate hemoglobin, guys? This is the, what is the name of this? Hemoglobinometer. Sahli's hemoglobinometer, right? What is this? How to measure ESR, isn't it? Wintrob's tube. This is Wintrob's rack. Pasteur pipette. Actually, this is packed cell volume, guys, not ESR. This is packed cell volume. This is the ESR, Vestigrin's pipette and Vestigrin's apparatus. This is the stand. This is very important, guys. Hematological indices. Mean corpuscular volume, mean corpuscular hemoglobin, mean corpuscular, at least these two you should know. They're showing reticulocytes here. Why is it green? They have stained it with some special stain, is it? This is differential leukocyte count, guys. See neutrophils, eosinophils. Then did they see any basophils, lymphocytes? So they will calculate, right? So this is the structure of normal blood smear, head, body, tail. Where will you observe? You have to observe here, right? At the tail, actually. Actually, it says at the junction of body and tail you should observe. You should calculate because you'll have one cell kind of count there, one cell layer. So this is how your peripheral smear will look. So here you have the RBCs, here you have the neutrophil. This is a large lymphocyte, this is a small lymphocyte, and what is this? Eosinophil. Eosinophil will have what? Spectacle kind of nucleus, isn't it? What are these, guys? Ovalocyte, acanthocytes, target cell. Yes, the name is poikilocytes. This is, look at this, RBC is a small pale in the center, more than 1/3, so it is microcytic hypochromic blood picture. Look at this, the RBC, where are the RBCs? This is bone marrow, there is no RBC here. Okay, this makes sense. Bone marrow, this is megaloblastic bone marrow. Just let's look at leukemias, guys. Now let us look at leukemias, acute leukemias. So basically, here you have acute myeloid leukemia, where what will you see here? Or rods, but they didn't show the rods here properly. Then you have chronic leukemias. So some diagrams they have drawn here. We're not going into the details. What is this one? Multiple myeloma. Multiple myeloma. What are you seeing here in multiple myeloma, guys? Rolex formation. Plasma cell with eccentric nucleus. So how will you determine blood group? This is important. You should put a lot of blood and agglutinate it properly, okay? Then you should be sure about the agglutination. Don't be a maybe. Let it be a perfect agglutination. Moving on to cytopathology, guys. Focus. Von Rokitansky. What did he find out? Some stain, I feel. Some diseases they have told. He also developed what? But why do I feel that there is some kind of a stain here in his name? Now comes all your diagrams, guys. What is this? This is a fatty liver, a lot of adipocytes they have shown, is it? What is this? Look at all the muscle kind of cells, is it? What is this? Benign smooth muscle cells with whorl pattern, hyaline cartilage. So this is hyaline change. Where does this happen? Hyaline change. Look at this. Acute appendicitis. What is this? Lobar pneumonia. Granulation tissue means what? Granulation tissue is different from granuloma. Granulation tissue means healing kind of tissue, right? See, there's an ulcer here. It's trying to heal. That time you'll get a granulation tissue. So you're seeing a lot of macrophages, lymphocytes, fibroblasts, new vascularization, plasma cells, neutrophils, etc. See, they have made this record nicely. They're giving you on this side the explanation, and here you have to draw the diagram. So you can correspond these two and read for your exam. See, this is tuberculoid leprosy and this is lepromatous leprosy. Let us look at this. Tuberculoid leprosy is a good version, right? So you will see some granuloma. It has tried to trap the bacteria inside. So you have your Langhans cell epithelioid lymphocytes, etc. So basically this is your tuberculoid leprosy. It's trying to heal, isn't it? It can at least contain the infection. But this is lepromatous leprosy where you will see clear space, that is zone of Grens. Right, thin epidermis, foam cells, lepra cells. Where will you see these foam cells, lepra cells in lepromatous leprosy? Just going to turn a few pages here, guys, so that you can save some time. Organizing thrombus. What is this? Cavernous hemangioma, capillary hemangioma, bronchogenic carcinoma. Then what is this? Wharton's tumor. It's one of the most beautiful slides. You can see Wharton's tumor. Where will you see, guys? Where will you see Wharton's tumor? See, you see all the lymphocytes kind of thing. Stroma shows dense lymphocyte infiltration. What are these kind of structures? Yes, it's parotid. This is a parotid tumor. This is a benign tumor of parotid gland. Wharton's tumor. Okay. Adenocarcinoma, stomach, chronic cholecystitis. What is this? Renal cell carcinoma or clear cell carcinoma variant. So you should see a lot of clear cells here. Yes, we can see a lot of clear cells. And I think this side is the normal. What do you say? And this side is the abnormal, is it? Didn't put any labeling on this side. Okay. This is beautifully drawn. What is this? Seminoma testis. Okay. So this is a common malignant tumor of testis. Most common malignant tumor of testis. Let's focus. Are you listening? This is seminoma testis. So beautifully drawn. The tumor cells are arranged in cords, sheets or columns forming lobules separated by thin fibrous septae infiltrated by lymphocytes. The septa are infiltrated by lymphocytes, is it? Tumor cells are uniform in size with vesicular nuclei and prominent nucleoli. So they should have a nucleoli also. Have they shown any nucleoli? Yeah. And inside the nucleus, you should draw a prominent nucleoli. Abundant clear cytoplasm. Nice. Carcinoma cervix. Shall we look at this, guys? Very important in your obstetrics. You will learn so much about it. So if you can draw this diagram, it will help you a lot to gain marks. See, squamous cell carcinoma of cervix. What will you show here? Endocervix. Endocervical glands. On this side they have shown ectocervix. So this is endo, this is inside, this is ecto, this is ectocervix. And ectocervix tumor cells in nests. You have tumor cells in nests. You have keratin pearls. Squamous cell carcinoma typically you will have keratin pearls, isn't it? So this is the most common, second most common tumor in women. It's squamous cell carcinoma is the most common histological type. You will see nests and sheets of malignant squamous cells. Individual tumor cells are pleomorphic, polygonal, with vesicular nucleus. Guys, focus. Keratin and mitotic figures, squamous pearls. Nice. Why is it? Why does this happen? Because of human papilloma virus mostly. So that's why they do screening with pap smear, etc. Right? Because it's so common. Vesicular mole. Let us look at this because this is also important for your obstetrics. You know, vesicular mole. How does it look? This is a complete mole. Complete mole means you'll have a lot of grape-like vesicles, isn't it? So this is your cytotrophoblast. Inside, what are they showing? Hydropic villus core is there. Hydropic villus core. Syncytial trophoblast, they're showing here. Trophoblastic proliferation. So basically, you remember this hydropic villus core, all the grape-like vesicles kind of. Nice explanation they have given on this side, guys. Most of the chronic villi will show hydropic degeneration. There is central cavitation, cistern formation. Okay, then there is cyto and syncytial trophoblast, complete involvement. That's why it's called as complete mole. Okay, then high level of beta HCG. That's important. So you will think they are pregnant, but actually they will be having a molar pregnancy. Osteoclastoma they have given here. Look at this photo. Basically, guys, this is all important for your orthopedics, right? Osteoclastoma. So this is giant cell tumor. Giant cell is there, is it? Is it called giant cell tumor if I'm not wrong? Osteoclastoma because there's giant cell. So it has giant cell and tumor cells. And which is the actual neoplastic component? The mononuclear cells. These are the neoplastic component, not the giant cells. Okay. So soap bubble appearance will be there in X-ray in this osteoclastoma. Basically, it is, what do you think it is? Clastoma. It's benign or malignant? Neoplastic is, they have written word. This is a pathological specimen. Actually, it's a benign condition, osteoclastoma, soap bubble appearance. Then, part 6, instruments and charts. Let's see the instruments and charts. Okay, they've just written, they didn't put any photos of instruments. But these are the instruments: lumbar puncture needle, liver biopsy needle, bone marrow aspiration needle, Winthrop's tube, Vestigran's tube, urinometer, RBC pipette, WBC pipette, Sahel's hemoglobinometer, then diluting tube, pipette, albinometer, Nuba's counting chamber, FNAC, that is fine needle aspiration, cytology gun, that is Franzen handle. Vacuotinus to take the blood, isn't it? There'll be so many colors of vacuotinus, you should know all of them. I think let's close this video on this pathology record. See you in the next video, guys. Bye bye.